Hello and welcome to the Corporate Wellness Therapist channel. I am Dr. Natalie Jones and I am a corporate wellness therapist. And it's my mission to help corporations remove toxicity and incivility in the work environment so that they can become a thriving and inclusive, productive workplace. I want to take some time today to talk about a subject that I've been thinking about since COVID and, just in working within healthcare and working within organizations and things like that. Um, since COVID has happened, I want to share a little bit about my experiences, because it's been a long time since I've worked in a hospital. I've worked, just in hospitals and in primary care, and then I've worked in psych emergency and inpatient and things like that. So I have quite a bit of experience in working within the hospital organizations, but one of the points that I want to hit on is and I want to talk about my experiences and what I think organizations can do to improve. And because I had contact with three separate places, but the experience were the same. It lets me know that this isn't a rare anomaly, but this is more of a common issue. One of the first issues that I notice is being a patient in the ER, is that you know when you go into the ER and you're telling people what your symptoms are, and you're talking to the doctor, you're talking to the nurses, and you kind of have to be very repetitive about what's going on. You see this person, and every person you have to you have to tell the same person the same story over and over again, right? Even though they're charting it in the computer and whatnot. And one of the first things that I notice is that there's a dismissiveness when you tell folks, these medical professionals, your symptoms, and they're not, for me, I was talking about like, oh, not feeling good, having trouble breathing, and, this and that, and, just having this significant abdominal pain. The dismissiveness came, and I have this every single time where, the first answer was like, "Oh, it's constipation." And I'm like, "No, I know what, constipation feels like." And so it's like, I'm telling you all these symptoms, and your first answer back to me is constipation. I actually got sent home from the first hospital. They were like, "Oh, no, it's constipation. Just do this, take some laxatives and whatnot." And I'm like, this is interesting. And so it was interesting. And it was also scary for me because I'm like, worried now that, while my symptoms are getting worse, I'm going to continue to be dismissed. And this is a very real fear. And this is something, it's not just with the ER, but just in interactions with doctors in general, interacting within the healthcare systems. There's been, a lot of dismissiveness just with me being a Black woman and navigating healthcare, what symptoms are and things like that. And so it's a real fear to go to the ER and then they just sort of dismiss your symptoms and say that you have this minute issue. It's like, oh my God, are they really going to actually even check to see what's wrong with me? Like, I think this is a serious issue. And so, just noticing that dismissiveness, that desire to like, you know, push you out with as little intervention as possible, and that suddenly adds to the frustration and the worry of being in a healthcare system. The second thing I noticed in the ER, and just waiting in the waiting room, and I've noticed this. This has been an issue in the past when I've worked at the hospitals, or when even when I've worked in psych emergency, is in the waiting room, there are people that are, what they do sometimes is they triage people And then, they may triage you to get blood work, they may triage you to get a CT scan, but if there's no bed space available, you go back out into the waiting room, and that's kind of what's happened. When I've been these 3 times, is that people are triaged, and it's simply amazing to me that there's people that sit out in the ER. There's patients that are sitting in the ER and they're partially clothed, or they don't have on a lot of clothing, and that the staff at the hospital, you allow people to sit in the hospital waiting room partially clothed, like with no shirt on, or with like, your boxer shorts on. And these are people that are sitting in like wheelchairs and things like that. There may even be people that are urinating on the floor, and just all these things are kind of happening, right? And so it's interesting if a person is being triaged or brought into the ER, and you know, you see that they don't have on any clothes, or that there's bodily fluids and things like that that are going on, that they're just kind of left there to kind of sit in that way. And I think there's just a much more humane way to do that, even if there's like a scrub, or like even like a one of those gowns that they can have on. And I think that would be much more humane, something to where they're covered and they're not just sitting there feeling ill, partially clothed, without a shirt on. And it's been more than one time that I've seen this happen. And that this is, when I went to the ER the last time, it was 3 people sitting there, men, that really didn't have on a lot of clothing. And they sat there, I sat in the waiting room for, a number of hours, and they were sitting there the entire time with me. So I thought that was, very interesting. And another thing that I noticed was, the interaction that clinical staff had with some of the patients. Given that I've worked in psych emergency, and I've worked in the psych emergency where where I've had to do manual restraints on people that were psychotic. Done 50 evaluations or admissions and things like that. I did that for a number of years. It's at several different locations. And so I'm used to seeing patients who come in mental distress under the influence of some sort of substances. Just maybe they're delusional from a UTI or something like that. Just seeing them in a variety of different mental states. And so, you know, it's interesting when patients are brought into the hospital, the police may bring them in to be evaluated before they have to go to jail. And so they may be screaming, they may be restrained, they could be under the influence of something. And I've observed patients that were kind of out in the hallway and just sort of screaming, because they're psychotic, or because they're mentally unstable, right? And one of the things that I noticed in terms was how the staff responded to patients, which is something I had never seen before. I noticed that nurses were kind of screaming at patients, they were cursing at the patients, and it was all like I could hear it as clear as day, as though I was right there. And not only could I hear, but the people who were in the rooms next to me could hear it, because I could hear them saying like, "Oh my gosh, that's nuts." And then what was also interesting was, you know, those nurses that were berating the patients, and cursing them and telling them to, shut, up. They were also coming into our room and working with myself and some of the other, patients around me. And so, the other patients would engage and like, oh my gosh, I don't know how you could, deal with that, and, this and that, and just sort of complaining. And it was interesting to watch the clinical staff interact with the patients and agree and continue to talk poorly about patients. I was very surprised and, just talk about how difficult it is and, just kind of putting the patients down. So I thought that that was I was like, wow, they're kind of talking about that patient, then they probably have things to say. And they were very open and candid about how they felt about, how they felt like they did not want to work with those acute psych patients and how difficult it was and how they just had poor mannerisms and things like that and how they wish they didn't have to interact with that. So they were very candid and open about that, which I thought was interesting and unprofessional to do. Another experience that I had was the bedside manner. Or lack of bedside manner. Again, I had spoken about the dismissiveness of symptoms, but it actually went above and beyond that. Okay, so one of the things that I thought was indicative of implicit bias that I noticed was that when I'm talking to these people, I keep telling them what's going on. What I noticed, even though I was inquiring, right, I continue to inquire, and I consider myself to be a reasonably intelligent person and asking questions about what we're going to do and what is the doctor thinking, is that I never got an answer from the doctor in terms of, what are we going to do? A nurse would come in here and there, and then they would, take blood. And then I guess there was something critical that showed up in my blood. And I didn't get told that right away. It was like, oh, we're going to continue checking and checking. Well, what are you checking for? I'm not clear on what you're checking for. Oh, there's just some things that we're looking at, and just kind of going, well, what is it you're looking at? So there was a dismissiveness in not telling me what they're looking at. Another thing that was done, which I thought was interesting, is that they did a full drug test blood panel on me, which was I thought that was interesting because you're not telling me, one, you're not telling me really any of the blood work that's concerning, but two, you're running these tests, which I'm not really sure why that was ran if I'm talking about abdominal, chest pain, difficulty breathing, and things like that. So that was interesting that that was ran. And it was like they tested for every type of drug, and didn't tell me about that. And I thought that was interesting considering I was lucid, I was clear, I was in pain, but I was lucid and clear, and I didn't have any symptoms to warrant that sort of treatment. Um, and the other thing was I was in a lot of pain. And, the pain was coming from breathing and things like that. And so with the pain that I had in breathing, it was very difficult to one, breathe, two, just move in general. And so, when they want me to take like, x-rays or CT scans, it was like, oh, you need to lift your arms and you need to do this. And when I explained that I couldn't do it, it was like this tug and this pull to try to get me to do something that obviously caused me a lot of pain and duress. And so it was forcible in a way. And I was like, no, please don't do that. We're going to have to do a workaround around this because that's just how quick the pain had escalated. And so, you, the treatment with that and physically trying to, sort of force me to do something which was very painful to do, I think that was very insensitive. But also, one of the things that I'll mention about the pain is, it was they ask you to rate what's your pain on a scale of 1 to 10. Okay, well, my pain is a 9 right now. Okay, well, just try to do the best you can. We're not going to give you pain medications. And so it was a treatment almost like I was seeking drugs or something like that, but they refused to provide anything for the pain. Um, and so, it was just this treatment. And lastly, what I noticed, which I thought was indicative of implicit bias, was I noticed a bedside manner of myself in relation to the other patients that were around me. Just for context, I'll I was the only Black patient that was in a bed space, and then the other folks that were on either side of me, they were all white patients. Um, I noticed that there was a different tone and a different style of interaction with those patients. Like the conversation was smooth. There was a lot of care given and, just checking in and talking about, other things like the weather or, movies or, just like all this extra care and given and sort of having these conversations with people. And I noticed that when they came into my room, there was like no conversation at all. I couldn't even get questions answered about what was going on with my medical care, just like your basic questions. And not only that, but when they kept coming in my room and leaving, they would leave. They would leave it so that there was no privacy. So they would just walk out of my room and leave things open. So the curtain was wide open. So again, people could see me half dressed. I had to keep asking them to close it because I couldn't get up and move during these times that I went to the ER. So it was like, there was no respect or sensitivity given for the state that I was in, where and I could hear, the other people when they would come and go, they would close their curtain, but mine was always left wide open. And even when I was leaving, the way they discharged me was like, okay, well, you have this, which actually turned out to be a serious issue, related to COVID. And they were like, we're not gonna, we feel like you should be admitted, but our hospital doesn't have a specialist here. So we're just going to send you home. And, if you need follow-up care, then you need to go somewhere else because we can't work with you here. We're not telling you not to come back here, but we're telling you that, you should go to another facility and not necessarily this one. This is something that I was directly told by the nurse. And the reason that he explained it is like, we can't, one, we can't keep you here because you have tests and we really can't run these tests here. You just need to go to another facility. And this is a pretty big hospital in California. Um, Another incident happened where they gave me my papers, my discharge paperwork, despite my rebuttal, because I'm like, I'm not doing too good. They're still like, well, you're otherwise you have good health. We feel confident that you're just going to heal and recover at home. Follow up with your primary, and if things get worse, go to another facility. But then again, when I was on my way out, another example of implicit bias is I was walking out and, I was like, I didn't know where the exit was. So I'm like, okay, well, where's the exit? I didn't get any assistance out, even though I was in a lot of pain. They just kind of left and were like, you can take off your heart monitor and everything yourself, and then you could just leave. So I'm like, okay, this is interesting. So I walk out and I'm asking the nurse at the triage desk which way is out. And she's like, do you have your discharge papers? I said, yes. And she just went on about her business. She didn't even answer my question. It was like, okay, like she didn't even tell me the way out. She was like, do you have your discharge papers? And that's it. Just, again, there's just kind of this, you know, just like you're not a real person asking real questions. Um, so, just based on my experiences at the ER, and I'm hopeful that I never have to go again, or that, hopefully there will never be any issues with COVID or anything like that ever again. But I definitely think there's some biases and prejudices there. It could be from being a woman, being a Black woman. I think a number of those characteristic traits played into that based on my experience and based on my observations of how people around me were being addressed. So I would definitely recommend like training and monitoring of how you interact with and how hospital staff interact with and communicate with patients of color, and just how you talk to and how you treat them versus everyone else. And I don't mean just your typical like, oh, let's watch a PowerPoint training for like 30 minutes and we can say that we trained it. No, like it needs to actually be a hands-on approach. And there does need to be sensitivity training around communication and treatment of patients of color. I was actually worried that I was worried that I might die in there because that's just how much I was ignored and looked over, and none of my questions were really answered. And I didn't really figure out what was wrong until, they were discharging me. And then even when they were discharging me, I'm like, this is so serious. I'm a little bit worried about being discharged. And, I'm still having these painful symptoms. Oh, yeah, well, get out, whatever. And if this gets worse, go somewhere else. So there's a real insensitivity there. And one of the other things, one of the other experiences I had was, they were asking for my social security number at the registration desk. And I said, I'm not going to give you my social. I'll give you my insurance card, but I'm not giving out my social. And that's just my preference. And I recognize that facilities can refuse treatment, and that's their right to refuse treatment to give out my social. But, and I explained that to the lady, and I'm like, I'm just not going to I don't feel comfortable giving out that information. And so it was a lot of hammering me to give it, and like, you need to come and give it. And it was like a real, just like, um, command, like, you need to give me that. And it kept happening over and over. And I'm just like, I'm not having this discussion. I don't feel comfortable giving it. I can give you my insurance, and I did provide my insurance, and I provided my driver's license, but I don't feel comfortable giving that out. So, do you want me to? I'm not sure what you want to do here, but I'm not going to answer that question again. So again, just sort of the clear and effective communication with patients, even if, you know, it's been a long day, or patients are, you know, out of their element, which everyone who goes to the ER, I would imagine, is out of their element, right? But there needs to be compassionate and sensitive, non-hostile communication, both verbal and nonverbal, right? Just in how you interact with patients. And so that's something that I would recommend. And also just compassionate care. Everyone that comes in, again, people are in distress, they're under duress. A number of things have happened, and they're not going to always be polite and hospitable or able to have conversations or able to advocate for themselves. But I think there's something to be said for treating your patients with compassion and care, and not talking about them poorly with other patients, not cursing them out, and, speaking to them in that way, because they are people too. And that could very easily be your mother, your sister, brother, father, whomever. So we have to remember that there could be some compassion for these individuals who find themselves in this stressful situation. And I think whenever, the last point that I'll mention that I would recommend is consultation when someone's having a serious medical issue. Like what I was saying was, oh, we don't have that here. When they were like, oh, we don't feel like we can treat you here. Okay, well, is there a specialist that you can consult with, or that I can be present with you consulting with, that like specializes in the area? Is there someone that you can call? Or can you help me get to another facility, which can take care of these services, offer transportation, if that's possible. If a person is in duress, or they can't necessarily take themselves there. But it was more as opposed to like, get out, don't come back. Let's help you find the next place where you can be better assisted. Let's get a specialist on the phone and let's spell out a diligent treatment plan. Like, not if your symptoms get worse, go here, but more so, let's consult and talk with someone and get a better understanding of what can be done or what another specialist who is trained in this would recommend, as opposed to throwing our arms up in the air and saying, it is what it is. Goodbye. Um, and lastly, what I'll say is, again, with the dismissiveness of the symptoms, I can't stress that enough because I felt like it happened each and every time. Again, I think that goes back to communication. I think that goes back to listening to patients. I think that goes back to wanting to research and find out what each patient's issue is and not just trying to triage, rush, and get them out of there. And, so my recommendation, and if you're interested in working with me as a consultant, is that I would definitely love to work with facilities and training them on kind, compassionate care and communication, because I definitely think that's a skill. And I recognize that working with people can be hard, especially when they come in a variety of mental and physical states. But again, we're in the helping field for a reason. So let's just remember that you chose to be here. But I would love to work with organizations on providing kind, compassionate care, effective communication and sensitivity skills, also working in hands-on training with implicit bias and prejudice, and how that is communicated through verbal and nonverbal communication, and talking and how to communicate with patients who about what you're doing, why you're doing it, and communicating with people in slow and effective communication if necessary when people don't understand what you're doing, or they need a little bit more help to understand what's going on. um, so I think those are the ways in which I would love to work with organizations to increase awareness and the services and the effectiveness and efficiency of how you work with patient care. Thank you all so much for tuning in to the Corporate Therapist Network. I appreciate you. And so until next time, take care of yourselves and be well.